So Leo Sarkissian with the ARC in Massachusetts. With me to facilitate today is Jackie Doherty. And you'll be hearing her voice in a few minutes. And what we're going to do, just to show you the agenda, we're going to do a very short one-slide project update from me. And then Jackie's going to touch on that pre-survey some of you filled out. We had nearly 60 people fill it out, which is pretty good considering we only gave you a bunch of hours to do it in. And then she's going to open it up for the listening session. And literally, my job is to do a lot of listening. I may jump in here and there, but that's what I'm hoping to do. And your job is to help us take that next step on the project. And you're an important part of us deciding the final direction of our plan. So I'm thrilled to be with you. And then here's a slogan, one of a few we're going to have. Your love for her is endless. Ensure your care is too. And it's about future planning and that care being there forever, you know. So update. So we've had 4 small focus groups. We've had 2 in person with parents, one here in this office and one in Plymouth at the ARC of Plymouth and Cape Cod. And we've had, those have been primarily with parents, family, parents, caregivers. And it's been a mix. Some people have had their loved one in a group setting. Most people that came did have them still with them at home. And we've had one sibling, brother-sister session. And that was really helpful. That was pretty well attended in terms of the small group. We've had, each of these small groups is anywhere, from 8 to 11 people. You don't want it much bigger than that because we're really trying to get in-depth feedback. And I'd say the smallest one were with people with disabilities, adult self-advocates. And in that case, in fact, my co-facilitator, Giazzi Brooks Abbott, was great, co-facilitating with me. And we had a good diverse group, which I was pleased with, which included people with different disabilities, autism and intellectual disability. And just it was really helpful, as have all of them been. So this is our 3rd large session, again, broader community input. So we've had 3 of those since I want to say January, late January. And we're also doing outreach to related projects nationally. And we're doing a technology review because, again, we want to be innovative. This is funded through the Innovation Fund that we received some significant donations for. And we've worked on this topic before, actually, over the years, over the decades. And now we really wanted to have an innovative mindset to it, which isn't just about technology. It's also about human growth, human learning, setting human networks. And then some of the findings, maybe you'll be surprised. I'm sort of shocked about the gaps in information. And it's especially concerning because the people that hear about this, they're probably connected in some way, right? If you're not connected in some way, you're not going to hear about these sessions. Even confusion about the state agency, DDS, what they'll do versus Mass Health. Some of that I get, though. I guess it's been turnover in those agencies. But finding carers or coaches to partially replace the parental role, that's obviously a huge thing. Concern over residential status in our very first session, that overrode a lot of the other things, other concerns. The quality of what is provided was a big one in the sibling session. And especially when people have more complex conditions, whether it's medical or behavioral, or a combination, right, of the both, even, or intellectual and medical. And then finally, maintaining a good rhythm of life in the future. I'm giving you like some of the things we heard. So before, hopefully sometime in the fall, not hopefully, we will have a game plan of what we hope to set in motion. And again, this session is going to help us with that. So I'm gonna hand you the ball, Jackie, and I think you're gonna go over this survey. Not go over it, I'm sorry, give them the same thing I just did, give them a couple of insights that you have from the returns that came in.
Yes, and thank you again for taking the time to complete the survey. As Leo mentioned, you didn't have a whole lot of time, but we were very pleased with the response that we got, given the time that you had. So let's just talk about what jumped out at us when we looked at the answers. The first question about discussing a plan with your family about the future for your loved one. Right out of the gate, we saw that 3.7% of you had done no discussion at this point. You hadn't had that opportunity. I'm sorry, that was 7.5% had not had any discussion. 3.7 had it completed. So the bulk of the people fell in the middle. 41.5% had done some discussion with family members, not specifics about the role, and 47.5% had a good bit of discussion done, but still working on the details. So we can see that at each end, there's still some work to be done with the really getting those plans in place with your family and your loved ones. The second question talked about housing. 46% of you said you had no idea about housing for your loved one. That is a big number, right? But yet on the other end of that, 30% said housing was all set, whether it was residential, a group home, or an apartment. So again, we're looking at, and in the middle of that was 24% are being told by DDS that your loved one will probably end up in residential care when you're no longer able to do that. So I think housing jumps out as a real concern with many of you, and something we want to dig into deeper. And then the level of support or assistance required, we saw that 48% answered that their loved one needed extensive supports, where minimal help was only 3.7% and medium assistance was 20%, daily assistance being 27%. So again, almost half, 48% needed extensive supports. And that's something to be thinking about as you're planning forward. How do you safeguard the care for your loved one in a way that you can be comfortable about? And then when we look at the financial circumstances and how dependent your loved one is on public services, whether it's from Mass Health, DDS, Social Security, we had 18% are totally dependent on public services, and 50% had modest resources to provide additional assistance, and 31% said they had more than moderate resources to provide additional supports beyond what public services provide. And then this one is of particular interest to us as we move forward with drafting a plan. And that was ranking resources and really what are your priorities in terms of where do you go or what do you need for resources? And 28.8% said web links with toolkits would be their number one way to get information. And the thing that, and Leo mentioned this to me when we were talking earlier, they really were spread out fairly evenly. If you looked at a bar chart in terms of what the resources were and how you ranked them. But the top three, the top one was web links with toolkits. The second one was ensuring that your loved one has self-direction, has some ownership over their life after you're gone or you're not able to be there. And that was 23% ranked that as the number 2 resource they're looking for. And the number 3 was assistance with family discussions on aging. 15% said that was a priority resource need. And I think it goes back to the first question about how many of you have already discussed it with, with your family members. And then the last question was also significant. What is the best way for you to seek information? What are you most comfortable with in terms of reaching out and getting the information you need? and 71% answered online was one of your most comfortable tools for getting information. 43% said telephone, just being able to pick up the phone and call somebody and get the information you need. And 33.9% said that online support groups, discussion groups, Facebook, things like that, where you have other people in similar situations that you can bounce ideas off of or questions, that has also been a resource that people are comfortable using. So I think, again, this was very helpful for us to kind of know more about who you are and what you're facing, the group that's in front of us. And I think that we would like to be able to dig a little further into that by hearing from you and what are the things that are most concerning you, and also, more insight of how we can help, how this project can provide you with some of that, the resources and the assistance you need to move forward with planning for your loved one. And I think we could, unless you want to say something else about the survey, Leo, I think we could jump to really starting to open it up to all of you. And I think we could start with just kind of, instead of going back to the survey, look at just an overarching question about what are the most cumbersome, or the parts of your support for your loved one that concern you the most in terms of being able to safeguard those services when you're not there to provide them. If anybody wants to jump in with some thoughts about that. I see Herb has his hand up.
Unmute him.
Leo, you're muted.
Yep, I think I just unmuted him. I thought I unmuted you, Herb. No? Let's try it again.
I-
How about
Okay.
now? Am I unmuted now?
You're unmuted now, Herb. Welcome.
Great, thanks. Yeah, I mean, I think how you turn the information on the individual's benefit structure over to whoever is taking over. There are so many elements to your DDS benefit, your SSI benefit, your SSDI benefit, and the list goes on. It's how you turn that information over. I actually discovered a product called Eleplan, ELEPLAN. And I've started utilizing that product to help try to keep track of all those benefits. And it would be a technology that the long term is my daughter takes over, but we're still trying to figure out the exact in combination with his brother, who actually lives with him as a shared living provider. But I think the transfer of that information is gonna take a while. It's gonna take people who kind of know the system. My daughter works for a human service agency out in Oregon, so that's gonna help her, I think, understand some of the intricacies of the difference between federal benefits, state benefits, et cetera. So I think that's really an important aspect of how my son Joe moves on and continues his benefit structure, and getting to know his support structure, kind of what he needs on a day-to-day basis, what he's comfortable with, what he's good at, those kind of things. It takes a while for everybody to figure all that stuff out. And like I say, this Eleplan product really kind of helps with that transition process.
Right. I'm having trouble. I can't see everybody.
Well, you're not, yeah. Am I
I mean,
muted?
I saw there was some other hands, but now I can't see them.
I got here, Diane.
Diane has her hand up, but
Go ahead, Diane. Thank you, Herb. Gonna put you back on mute, but thank you. Diane,
Hi, for me, it's the inconsistency with information, regarding the services that could strengthen and grow the supports for my son. It's lack of documented information. And so it depends on who you're talking to.
and do you mean that with the medical world? You mean that everywhere? You mean that with the state, your contacts in state government when you're trying to get questions answered?
Yeah, I mean, overall, for us specifically right now, using the self-direction service model, right? So, you know, where my son is now into his 10th year using the self-direction service model. And this past year is probably the first year that we have been able to really grasp a greater understanding of how the model can work, how it should work. And, you know, and just bringing this information back to specifically the state agency DDS. And yeah, it's been a challenge. So we have like a great home vision. You know, we've shared our home vision, and unfortunately, we don't have enough people who, and when I say people, those who have the authority to make the decisions needed to strengthen my son's support. We don't have enough people who believe in this vision, and it's basically just building a home and having, you know, my son's apartment attached, you know, so a lot of work to do.
Yeah.
Thank
And I
you.
think that has been a challenge, is looking at what is the consistent, accurate information out there? Where do we find the most accurate information?
So I'm
Robert's-
trying to see if Katarina, yes, Diane, thank you. Rob Beckett's on, if we could unmute him. There we go.
The first person that spoke, was it Herb?
Yes,
Yes.
I would like to get from him I couldn't pick up something like Ella Plan, but I'd like to get where I can get to that website, if possible. The other thing in terms of Herb's comments, it was a focus on you know, the public benefits available, I think. But, you know, the overall situation to me is whether you're a parent or a sibling or a guardian, and this kind of covers kind of from the mild to the severe impairments, probably more the moderate to severe. But basically, the family member is often really performing a case management role as well as a decision-making role. And those are two separate issues. And what I mean by that is that a lot of times a family in the elderly world will hire a social worker to be a case manager for their spouse or for their adult, for their father or mother, and they'll be the decision maker, but they'll have some type of case management going on. But in the world of developmental disabilities, it's largely the families that take on the case management, and the public case management is just not going to work for the wide situations that family members get involved in. It's not just the public benefits, it's the whole healthcare system, because that's not part of the public benefit system necessarily. I mean, that's Brigham or Boston Children, or that's therapies, or that's whatever it is. Those are healthcare providers. And it's also the financial side of it, of, you know, not only what are available from public benefits, but what are available as far as any supplemental resources that the family might provide. So, and a case management, or sometimes called care management, typically has been a social work degree position. So the way I look at it is, and I don't think that's necessarily realistic, you can hire social workers, a guardian can hire social workers to help. But I think that a portal that would assist people in developing a broad record of what they're already doing. These are things people are already doing. They're communicating with DDS, they're communicating with physicians, they're communicating with financial advisors, they're setting up trusts. They're already doing these things as far as case management. But to set up a portal where they can, or some type of a system where they can record all of that, and then of course that becomes transferable to the extent that they want it to be transferable to other family members. So I think that Herb's thing was a superb idea, and I just would broaden it, I guess, because I don't think we're ever going to be able to depend on a public case management system. It's just not there throughout the country, in my opinion, and especially to the broad areas well beyond public benefits. The other thing I wanted to say was, although I think it was I think it's a good move on the slogan or the input. Care Forever bothers me because I'm looking at a situation where while my son is 47 and needs a substantial amount of self-help care, we're still in the process right now of getting ourselves seriously with independent providers to make sure he gets it learns how to put his socks on properly and using both hands. And what I don't like about caring is, and he's also developing his internet and phone skills. I don't like Caring Forever because I think it doesn't emphasize the learning that needs to go on and the skill development. And it focuses on I think dependency in a way. So I although I like it, I think it's emotional and I like it. I think it doesn't cover the independence and the learning that's fundamental. Although I will say caring is the most fundamental. So don't get me wrong on that. So anyway, that's just and also I think then last as Herb brought up on the whatever this plan is or this website, I think technology can be incredible. And I think you have a tremendous wealth of people out there who are already doing sophisticated case management. They may not have it all organized exactly, but they've got tremendous records and they interact with many systems dealing with their child. And I think that connecting them in some type of open source and even using artificial intelligence down the line where individuals can work together to develop the best portals they can and not depend on nonprofits or proprietary systems. I think that's another idea because you have millions of very people that are already doing this, and they're doing it every day, and it doesn't matter whether the child's living at home or the child is living with out of the home. They're doing it. They're remaining doing it every day. This case management function.
Right.
Okay.
Good stuff. And boy, the three so far gotten really helpful stuff. And by the way, Katerina posted the plan, and there's a few of us will learn more about that next week. There's a couple other portals, but I had not heard about that one myself either. So thank you on the portal, and Rob and Diane, thanks. Judy.
Hi, guys. Yeah, so Herb was a great guy to start off with for two reasons. He brought up the basic question of how to really transfer the information that is held deep within us parents to the next generation. That was one thing. The other thing that he mentioned that I'd love for him to send off offline, and that is, he said he had a daughter in Oregon that worked for the system. And Laura, my daughter, will be very well might be going out there when I die. So that would be a lovely connection that I would love to have.
That's Herb's daughter, Judy.
Yes.
So we can connect you guys. Yeah.
Okay. And the third thing, and really the thing that is an impact for me is, of course, who is going to be there for Lara when I'm not? And that, that doesn't have to be the obviously the PALS model, but more having an advocate who is here and present. I just see in the last month or two, we're struggling at the house because of staff and sickness, etc. And if I were not there, it would not be pretty. So how to deal with an advocate. I don't know if that advocate is a case manager. I don't know if the ARC gets into that line of business in some form where there's, I don't know, a care manager, an advocate, fill in the blank for whatever you want to call them. But that's my issue, I think, going forward. Thank you for having this.
It's great, Judy.
Yeah.
Jackie, I'd like to make a comment on that. Like when we talk about replacing the parents, of like three themes, right? One is you're never going to replace all that the parent does, but
Right.
what is that role? And we've got about, I think, 7 different roles, or more. So that was important for the community, what Judy was getting at as well in terms of that. So yeah, that's in there. That's one of our but again, we need to reinforce because that's the toughest one for people too who are not going to necessarily have money to do that with. And you're building on Rob Beckett's point, which is, the case management, and you're talking about case management plus. My hunch is he probably was too, but you're getting at that really, key thing. Anyway, thanks, Jackie.
And Laurie has her hand up.
Yes, hi. Hi, Leo.
Hi,
Nice to
Lori.
see you.
Good to see you.
So 2 things. One, I do want to remark on the financial one, the part of the survey, but let me do that in 1 second. I think for me, as hard as my husband and I have worked over the years in order to create wraparound love and support, for Ashley, we think about when we're not here anymore, the roles that we take now are really going to have to be divided up between her siblings. So I'm not just replacing my tasks, if you will. I'm basing who has the strengths in these areas to take on, who's going to do the medical, who's going to make sure that all of her public benefits are in line and somebody got the renewal and they actually filled it out and mailed it in and followed up, and who's going to take her out to dinner twice a month, like dividing that up between all the siblings. And as much as we can meet and talk and, they can volunteer for what they can volunteer for, what we worry about is, what if someone moves to California? What if someone gets sick or their loved one gets sick or their husband gets sick? What if any of them get knocked out? And now we've got a table missing a leg. And I don't know how to pre-plan for that. And I'm trying to talk to them saying, who might be able to step in should any of these 4 legs have to step out? You know what I mean?
Yeah.
And we can't plan for every inevitable.
Right.
And so the backup plan for the backup plan
Right.
is not non-existent, and that just worries us. But the remark I wanted to make on the dependent on public assistant, that financial part of the survey, I worry that answer, which was kind of low, totally dependent on public assistance. I forget what the exact number was. It was kind of low. I worry that that's not good information. Because when I think of myself, for the past 25 years, I've never been able to work any more than part-time.
Right.
Because I'm part-time employment and part-time case manager, right?
Yeah. Yeah.
I am not an extraordinary person. That has got to impact a lot of people, right?
Right.
So the capacity for me to build for retirement and for future had been greatly diminished. And I'm not whining about that, but that puts my daughter a little bit more heavily into the totally dependent on the public assistance. And the other thing about that category is, are we reaching those families who have never worked or who themselves are disabled with loved ones at home? Because I feel like that number would rise exponentially if we really thought about what those numbers were in reality. So I appreciate that there was a survey here for those who found out about it, the comment that Leo made at the beginning, and found their way to, the information and then registered and then did the survey beforehand. I don't want the project to, in any way, shape, or form, be diminished by impoverished information. So
Yeah.
I just think of that category of families, I think is much higher than, what the survey may have revealed in today's, session. So just wanted to put that there.
Yeah, and I think that's a very valid point, Laurie. I mean, we recognize that people who are here today are already engaged and they're aware of resources, that there's a lot of families out there that aren't aware of what opportunities might be out there. So that 18%, which was the number, I think is low, that there are a lot of families that are very dependent on the public services and may not be aware of what those, options even are for them. So it's an important point, definitely. And as you look at this splitting of your role into these pieces, as people have been talking about, the case manager, the social worker, the medical piece, what are the ones that are most concerning? And how do we get to the next step? And I see Pam has her hand up. Pam?
Hi, can you hear me?
Yep.
Okay. I wanted to tag along with what the very first speaker said, and then the fellow that was talking about Ella Plan and case management. I really think it's important that we have some sort of plan, documentation, guidelines to follow to build towards getting all of this information in one place. It's really overwhelming when you look at all the different pieces that your people touch, down to who are your PCAs? What we haven't even talked about, like the social things that they might do, or the clubs or whatever they might be involved in. It just and the more you think about it, the bigger and bigger it gets. So yeah, I'm a very organized person. And I think if we had, like, even to start, just a template that you could start with to start getting this information down. What are all the things to think about that we need to include in this kind of thing? And then move that forward. I absolutely think that we can use technology. If we have some of that as a base, then move into, let's use technology to get this information in. Because it also, my son is 23. His world is changing, that's a huge step, and it's going to continue to change. So if we had something that it was, once you get a good portion of it in some sort of system, then it's easier than to update it, change it, add things, include it, give some people access to it. But I think it's more than just giving people access to a system, like people that may be involved with him, both now and in the future, who you're going to turn it over to. Just giving them access to a system, they still need to understand the whole picture. And so I feel like we need to have two things. One is, here's your vision, here's the big things, and then here's how you can manage it. Here's how you can maneuver around it. So I see it more of a continuum.
Mm-hmm.
Well said. Well, this is helpful, and I think this just emphasizes the need for us to have a plan that, grasps and do what we absolutely have to do, because we probably have limitations, right? And clearly the template, and then the question is there something out there already that's not expensive that we could latch on to and or be a co-sponsor of, or whatever, that could address that as well. Good stuff.
I see. Stephen has his hand up. Stephen?
Yeah, I listened to the survey results and I thought, I didn't see the survey, but if I had, I would have needed the answer which said not applicable for essentially every question, because communicating with someone, first of all, doesn't speak. Second, his form of communication is limited to someone who might be 4 to 7 years of age. He's actually 30. But when we look at care plans, what the future holds, the problem is after we're gone. So having a home for him with nobody to manage it is a non-starter. Other than just simply being in a group home, I wonder about the possibility of private facilities. There are resources available to assist him, but if they exist, they're doing a real good job of hiding. And I guess DDS isn't allowed to make reference to them because that would be showing preference or something else. So we're sort of sitting in the dark, not knowing if there's an organization out there which could help take over once we're gone.
Gotcha, yeah. A better information sources. Because, yeah, this is a diverse group of people, and so making sure people hear about what's out there. Go ahead, Jackie, anything you?
Well, I see Julie has her hand up, and there are also some questions in the question and answer, but let's go to Julie first, and then we can talk about some of the questions that are in the Q&A.
Yeah,
Julie?
hi. Yes, hi. Can you hear me?
Yes.
Okay, good. Yeah, so I'm new to this project, and I feel like I stumbled into it. I was at a gathering of Michael Wiener's group, the Specialized Housing, a couple of months ago.
Yeah, good
and
group.
yeah, and I brought this up because my husband and I are older parents. We have an adopted daughter. She's in her early 20s. And we've been thinking about this. I was laughing when the woman a few minutes ago was talking about the table legs, because we have no legs on the table. You know, my daughter has no siblings. We have no cousins, and we have no family really in the area. So or really at all. You know, anyway, I stumbled into this, and I'm glad someone mentioned your name, Leo, and said, "Oh, contact Leo." So I went on the internet and, found out about this. I feel like I've missed some of it, but I'm happy to be, part of it now. And I can resonate with all of the things. My questions would have to do with transferring information. And, my husband and I are absolutely case managers right now for everything for our daughter. So I can relate to all of that. But my question is, my daughter is not a DDS client. So, she doesn't have an official autism diagnosis. She has nonverbal learning disability, which is a lousy, diagnosis, because it doesn't, it doesn't get you anything. And yet she has all the problems that someone with bona fide autism would have. She was a Mass Rehab client. Now she's not working. She was a DMH client and then wasn't. And now we're reapplying for that. So I just want to make sure, she has SSDI. So we have some things in place. But I want to make sure, my husband's turning 80, I'm turning 70. And, we don't have, how can I put this? We don't have what we need. And I just want to make sure that we're plugged in and that we don't lose out because she's not a DDS client. So that's my main concern, is that I'm part of this group and that I stay, and that I'm not, my daughter seems to have always fallen through the cracks. And yet we need these pieces of, help after we're gone. And while we're here, starting to transfer care and advocacy and information while we're here and able. I want to start relinquishing that. This is what I do all the time. That's my whole day, all the day, is helping my daughter. So that's what I have to say. Thank you so much for this.
Sure. Julie, I just want to say, make sure, someone in Michael's group may be able to recommend care manager initially for a few hours for you to start looking at those specific things. Sounds like you're on top of it with your husband anyway, with DMH, and looking at Mass Health to see if she qualifies. She might be one of those people that would fall through the cracks on that because of eligibility guidelines. But I would make sure you sort of covered all those bases in the short term. And then you're, of course, you're welcome to be part of this group, and hopefully we'll be setting up networks and connecting to networks that already exist, so that, we're collaborating, in this journey together. And obviously these networks are all over the place. There's even sports. I just want to comment on this, Jackie. I was working on something in the South Shore on helping out on something, and I discovered yet another small recreation special needs activities program. And I know of them in different parts of the state, but I said, oh my God, here's linkages for us to connect with people that necessarily aren't connected with a chapter or an agency that works with us and collaborates with us. So, because it's really manpower, right? How you connect with people. It is based on both staff and volunteer manpower. So anyway, so yeah, please welcome Julie, and thank you for sharing your story.
And the good news is we're just getting started with this
Yeah.
project. So you haven't missed, not that you haven't missed much, but it's ongoing. And I wanted to also recognize that Deborah had written in, she didn't get the questionnaire because we sent them out a couple of days ago. So if you hadn't registered by then, you wouldn't have gotten it. But I don't think there's a problem with sending the questionnaire out again.
Well, what
after
we
the
might do,
session.
Jackie, what we might do, Katerina and I were discussing maybe like a longer one later that
Okay.
will amplify. So we wanted to have, just some things to share with people today from their peers, their our family, so to speak, our community. So, but if there is, I'll leave that to Katerina and you to talk with me later.
Well, I mean,
It
we've
makes
got you
sense.
captured your information now that you are registered, so we will be reaching out again, whether it's this questionnaire or a more involved one.
The survey link is in the chat. I put it in a few minutes ago for anyone who did not complete or receive the survey. It's still open. So if you want to submit your answers to that one, in addition to any future surveys we might be sending out, you're free to do so now.
Excellent. Thank you, Katerina. And Deborah also brings up the point, what happens when you don't have siblings and relatives? And it is more challenging, obviously, if you don't have a big supportive family that you can turn to and discuss these kinds of roles and things like that. It does create a much more frightening challenge for families. And I think that that's something Erica mentioned. What about offering corporate guardianships or an advocacy program to provide long-term support? And we actually have a webinar next week as part of our education series on special needs trusts and establishing a trustee. That's only one piece. As Robert talked about, you're carrying all these different roles, but it's one thing to be looking at in terms of where can I find resources of trusted people that I can put in these positions if I don't have immediate family to provide that service. And I see Lucy has her hand up. So
Hi,
I think
Lucy.
Yes. Hi, hello. Good to see you
Hi.
both.
Same here.
I guess I am agreeing with almost everything everyone has said. As at least Leo knows, I have a son who has profound intellectual disabilities, and he has two siblings who have agreed and are guardians currently to take care of him when I'm gone. But I guess they need someone to call. They need someone who can answer questions. So we need an agency of some kind or a group of people who would be case managers and be hired by families. If you look at the special education system and how advocates have been trained, most of the training probably was done by the Federation for Children with Special Needs. And many people now are earning their livings and being very helpful to families as special education advocates. We need a similar kind of system where families can hire somebody, hopefully before the main caretaker dies, to be able to talk about, what their vision is. And then the siblings are going to have different ideas, of course, but yet they don't know in detail what's involved in all. I personally have a son who served in a day hab and residentially by a vendor who's trying to do a good job, but there are issues. There are always some issues. I spend probably, I would say, 5 or 6 hours dedicated to my son every week, trying to take care of what's going on and calling and making sure this is done and that is done. And I don't know if my children would have the patience to do that for him, but maybe if there were someone guiding them, they would do the work. but someone guiding him and saying, why don't you look, at this issue? It doesn't seem to be going well. Maybe he should go to the doctor to check on something. To somebody who would be a guiding light, who's educated on the issues of particularly people, for me, with profound intellectual disabilities. So I see the need for something that doesn't exist now, and as people have talked about, case managers, and hired at a level of that isn't extremely expensive, so most people couldn't afford it, but at a level that's affordable for people. And I think that would be very, very helpful. And the sooner the better.
So something on that though, Lucy, like you're talking about two different hats, right? One hat is someone who's here to give advice. The other hat is to hire someone who can go in firsthand and evaluate, because you're saying.
If needed,
Yeah, if needed, right?
Yeah.
So if we called Span Mass today, so here's the dilemma we're gonna have as we look
No,
into
don't
it.
call Span Mass.
No.
please.
What I'm saying is, no, I
Right.
want you to understand. No, you're not here. Just hear me out. One issue that we want to look at, right? And we don't know where we'll land on this, is everything from helping people find people that will be connected, right? To, what is the list of care managers out there that exist? And the reason I gave Span Mass as an example is only because people are listed there and you're basically hiring people, you're not paying an overhead cost. Okay. Whereas it's an organization, but even there, I bet you it's expensive. So it's figuring out how can we offer something, or if it's not us offering, how can someone else with us offer something? Because you're right, because it could get expensive, right? And so we have, that's going to be, I think, the most challenging part of whatever we work on, but thank you. Yeah, we know your messaging and others' messaging is really reinforcing to us how important it is.
Right. And I think some of it feels like it's much more manageable, like developing a template. A couple of people mentioned this idea, even to just create the world of what's the information we need to be thinking about, what's the areas that need to be covered. But the staffing piece, I think, is going to be the most challenging. If it's a resource, like someone asked the question, what about getting a list of social workers who could be future case managers? Or what are resources around housing, creative housing? Kathy Boyle, Laurie mentioned Kathy Boyle, and Gail Kendrick, excellent for helping to create family boards. But I think the template sounds like a wonderful, we could handle that. We could come up with something like that. And Herb also mentioned the idea of using Charting a Life course as a starting point for thinking about a roadmap, and what would be involved in developing a plan for your loved one. And he mentions that there are many technology products under development, specifically designed to support individuals looking at what's out there right now, what's on the horizon. Stephen mentioned, do non-public, not remember the group homes exist? Are there non-public group homes? And if so, how can a family find them? I don't know about that. I know that families are developing their own kind of systems. I don't know if there's a resource of non-public group homes. I don't know, Leo, if you know about that.
Yeah, we can. I mean, I think we could happily put lists together of things like that, and that should be added to our list. We're recording this. We'll have a transcript, and there's a group that came together. I'm not sure how private they are, because even the early private ones, right? Eventually people advocated for funding through the state. So then there's still, but I'm sure there are some very private situations that hopefully we'll be able to identify, for people like Stephen.
Right. And I see Beth has her hand up. Beth?
Oh,
Hi,
Beth's
I'm
got-
sorry. Can you hear me?
Yes.
Yes.
Okay, hi. I am sorry I missed the beginning of this. I'm a mother of a now 24-year-old DDS young woman and also a social worker by trade. I think I'm not a computer person, although, obviously have to use it. I think some of the templates and such, if people have time or a mission to Google stuff, they're created already, and it could certainly be tweaked to specify, but a lot of the special ed stuff, federation stuff already has that, could be tweaked for, older adult people. I'm not sure that there needs to be somebody needs to do it, but completely reinvent the wheel in terms of case management. There are some agencies that may not work with you, but they can give resources like, your councils on aging or Jewish Children's and Family Services have case management for disabled people, things like that. In terms of private group homes, those have been around for years as well. You buy into them like a condo and they're staffed and you pay, whatever. I know a intellectually delayed individual who's now, I think she's going on 70. Her parents had the the foresight way back when to start this type of thing. And there's a bunch of them now in Brookline. I see things pop up on my special needs, parent Facebook pages of grassroots, a group of 5 is looking for how to do that or where to put it. The problem is, as the lady whose vision is to build onto her home for her son, that's a great vision, but if there's no finances behind it, that's not a realistic vision. So I struggle with wanting my child to, like everybody else said, what's going to happen when I'm not around, and don't have the finances to buy her a condo. I barely have the finances to keep her living with me, although I'm happy to do so. Again, preaching to the choir, no family to take her. They could technically, but space and money and this and that. They're not going to let her be on the street. And I ask, so my kid is a DDS client. We have a case manager, very different world going into adult DDS than child DDS. And you don't have the special ed school resources, for better or for worse, that you did have, that make child stuff look like Disney World versus adult stuff looks like I'm on a barren island. As much as when I was in the child stuff, I was, like, oh my God, this is wrong and that is wrong. So we have a DDS case manager. She has, there's a vendor who works with her, whatever it is, state allocation of money when they're adults. I guess it's $3,000 a year right now, until Elon cuts it or something. I can have these visions. She can have a vision, but if she doesn't have money, there's no transparency in DDS kind of reassuring me, saying, oh, well, if something happens to her, we'll put her on a group home list, or there's no group home list. They triage it as needed. There's not a lot of transparency to make me feel better about that, and there's not much I can do to set aside money for her, or I guess put her on housing lists, and she can't live alone. So
Beth, first place, thank you very much. I appreciate you sharing the situation. You are new, I can tell, to the DDS and everything, because these are the very normal, typical reactions, right, to the lack of transparency. There are options around shared living, all kinds of things that people get funded for. But at this point, you're right, they're probably giving you the stiff arm because they have other people to serve, but that's part of the advocacy in the system. But it's also, understanding there could be programs through Mass Health and other places that she or he may qualify for, but this is helpful. You know, it just reinforces the lack of information that families receive when they, you know, come into the system. So I want to thank you for sharing your information.
Deborah Lee has her hand
And
up.
one thing, Jackie, I just want to tell people, because Beth reminded me, there are homes for Steve and there's specialized housing. You can Google them and see. I wasn't going to get into specific referral stuff today, but I'm feeling bad that he's looking for something. There's a coalition that High Spirits put together. I'm sure they have some public funding. I can't imagine they're totally private, but maybe they are. But those are two things just to get him started, because Beth reminded me of that in her comments about the condos. So, and there's other ones. So I'm sorry to the other ones I've left out. It's not on purpose. It's just there's a lot of disparate groups out there. They're not always promoting. Okay, go ahead. Sorry.
Well, I saw that Deborah had her hand up. Deborah?
Let's unmute Deborah. Or did she, or maybe she didn't mean to be. She doesn't have her hand up, so.
Oh, okay. Sorry. Oh, Lee has her hand up.
Go ahead, Lee. So can we unmute Lee?
Okay. Hi, can you hear me?
Yes.
Sure.
Oh, excellent. I'm so sorry. I know we're out of time, so I'll keep this quick. I put something in the Q&A. I love what all the parents have said. I have to say also that I love the ARC. I find that a lot of what I've done so far for my son has been information I've gotten through the ARC. For example, I have a binder that I put together with all these tabs for housing, government assistance.
Oh, wow.
Tim has a picture that he put on the front that says, this is what I need for my support. This is how to talk to me. These are my best friends. This is what scares me. So all of that stuff, I think the other parents probably know this, but they can find that stuff through the ARC. I put this in the Q&A, but I would highly recommend, if you guys don't have this already, that you have something like the coffee hour or a support group of some sort for when something happens to us as parents, that next guardian or that caregiver has a place to go to talk about the stress, the resources, the information available. And so they don't feel so alone. Definitely would love to see that happen. Also was wondering, and this can be sent to me privately, or if anybody has any resources, sadly, my daughter is still struggling. Tim's only 22, so hopefully this will change, but she's still struggling with, I think what might be like grief, but she is not in a position emotionally to sort of support our son in any kind of way. She does not want to be the next one, and we only have the two. So, you know, she gets pretty frustrated with him, and so would love to have her have support. We have other family members in our system and friends that are willing to be kind to Tim and take over after we're gone. But any resources you have for siblings that are not volunteering and are struggling with having a child with a disability would be greatly appreciated.
There is the MSSN is a sibling. They have like a drop-in for I forget how often it is, if it's monthly, but it's Massachusetts Sibling Support Network. There you go. And if you Google it, it should be pretty easy to find. And Herb mentioned earlier, as we're wrapping up here, the Trying Life course. We have a product called Tools for Tomorrow that it's free. You got to go online. It's thearcofmass.org/tools. Scroll down. I don't know why it's, well, I guess it embeds the Charting the Life course for you to develop a vision. So if you want to, you know, it's a PDF copy you can download. It was initially developed decades ago, and then it was updated about, I don't know, several years ago, maybe 8, 9 years ago. The donation, we updated it. Rosalie Eads oversaw the transformation of it. and we embedded Charting the Life course in it. So, and all you have to do is type in, you're forced to type in, sorry, your information to get the free download. So that's another vision tool if you guys, it's not the only vision tool, it's just a tool out there that's for free. So.
And I just want to mention, I think that the sibling support network can be very helpful for your daughter to realize there may be one piece of support that she can give or one part of support that she's not comfortable with, but to find a place that she can fit in as a support network. And I also want to repeat, wrote in, friends can be family too. It doesn't have to be a biological connection. It can be a friend that can be part of the support network that you create for your loved one. But the sibling support network is a good place to start too.
Great. Right. Should we take one more? It's, I know.
Well, I don't see anyone else's hand up right
Oh,
now,
but
I
okay,
do want
maybe
to, Laura made a comment.
Okay.
And I think it's helpful to hear. As you all plan, please keep in mind that some of us are not on any public assistance. We have resources in a third-party SNT. We work with DDS under the Autism Waiver Program. So she's getting specific about her situation. Our 24-year-old son receives support through Agency with Choice. We have no other children, no family in the area. Templates, where to start, support and info from other parents, resource referral, financial planning information. These would all be incredibly helpful. And she's thankful for our work and grateful for it. And I think it's been so helpful for us to hear and share these ideas and have, as Leo said, what's going to be our plan going forward, how we're going to use this information and develop resources, whether it's, the Innovation Fund program, really rolling out some specific things, or the ARC itself through our education series, continuing to develop webinars that kind of answer some of these questions or help you on this path, because it is overwhelming. It's a lot to think about, but you've got to do it one step at a time. You really need to be thinking about this. You don't want to be in a situation where something happens and it's an emergency crisis and you don't have a plan. So that's what our goal is, to helping you get those steps taken. Leo, anything you wanted to add? I don't see any more hands up.
I think we'll probably start. I know we could go on probably, but I want to, thank you, Jackie, for facilitating this. Really appreciate it. And, just can't thank all of you enough for taking the time and helping us learn from you as well. And also all the suggestions we we received. Thank you. I'm going to ask Katerina to end the meeting.